And Israel now says beginning Sunday, it's going to administer a third dose of the COVID vaccine to its senior citizens. Here in the U.S., Pfizer is also making the case for booster shots, saying new data shows its vaccine's effectiveness goes down after 6 months. Now, this comes as 45 states are seeing an increase in COVID hospitalizations. Let's bring in ABC News medical contributor and infectious disease specialist, Dr. Todd Ellerin, for more on that. Dr. Ellerin, thanks for being here. Let's start with this new Pfizer vaccine data. It's showing its vaccine efficacy drops from 96 to 84% after 6 months. How important is this data? How big is that drop? And how worried should we be about it?
All right. First of all, Diane, I don't think we should be worried. The Pfizer vaccine, even 6 months out, is performing very, very, very well. You know, with that said, I think what's really important whenever I hear about the need for another booster, the first thing I think about is what about all the unvaccinated people? I think it's much more important to get people who are unvaccinated the vaccine than to give a booster. Now, with that said, I think our FDA and NIH and CDC have to look at the Israeli data and, of course, even more importantly, the real-world experience in the U.S. and ask, is it time for us to get a booster? Now, remember, Israel is not saying that everyone needs to get a booster. They've started with immunocompromised groups, which our CDC has already said it's reasonable for us to consider boosting people who are immunocompromised, but they're really boosting the elderly now, those over 60. So I think it's a vulnerable group, and it's something that we have to look at closely in the U.S. as well.
Does it have to be one or the other? Do we have to choose between vaccinating more people for the first time versus giving people already vaccinated boosters? Could we do both?
Diane, oh man, Diane, I really think that we can, and I hope that we do.
And Doctor, the data for this study out of Israel came in March. That's before the Delta variant became the dominant strain. So what does that tell you about what we're looking at here?
Terry, that's a really important observation that you made. The 84% is really mostly with the Alpha variant. But so what we can expect is that 84% is likely going to be reduced significantly. We already heard some real-world effectiveness data from Israel that it was 64% just maybe a month ago. And now most recently we've heard that that has dropped to below 40%. That hasn't been peer-reviewed yet, so we'll have to watch for that. But as we see reduced effectiveness of the vaccine, obviously the thoughts about boosting becomes more and more relevant.
It feels that way, that's for sure. The CDC's now saying also that if you're fully vaccinated and you're exposed to someone with COVID, even if you don't have symptoms, you should get tested and wear a mask in public for 14 days or until you get a negative test. What do you think about that guidance? Do you worry that more rules? I mean, I think people are confused, they're worried, they're angry, some of them. Here's another layer.
Right. I mean, we are having close to 100,000 cases a day now. The last 7-day average is in the 60,000 range per day. So, you know, cases are going up. We have half the country that's unvaccinated. So, you know, I think it's really important to follow what the CDC has just come out with, and that if you are in a warm or hot zone with COVID-19, we should be wearing masks indoors. Also, if you're immunocompromised, if you're vulnerable, elderly, I think no matter where you are, it makes sense to mask indoors. And remember, by doing this, we're actually protecting those that are vaccine hesitant, those that are unvaccinated more than those who are fully vaccinated.
And later this afternoon, President Biden is set to deliver remarks on new plans to prevent the spread of COVID. Among them, these potential new requirements for federal employees to be vaccinated or undergo weekly testing. Could this set a precedent, do you think, for private companies that aren't already doing this? And do you think it's necessary?
Diane, let's do a quick thought experiment. Let's say that later this year you're out on maternity leave, okay? And good luck with that, by the way. And, you know, and you come back to ABC. Do you want to come back to an ABC that's fully vaccinated, or do you want to come back to an ABC that's partially vaccinated? You will have 2 young children at home. They won't be eligible for the vaccine. You know, when you think about that, it makes sense. The type of leadership we're hearing from President Biden right now, really what it emphasizes is a culture of safety. And I think that's what these type of mandates are doing. We can think of it as punishments, but it's not. These vaccines work, they're effective, they're safe, and we have a virus that's, again, out of control, and it's summer, by the way. That's not a good combination when you think that winter is coming.
All right. Dr. Todd Ellerin, always great to have you. Thank you.
Take care, guys.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.